me start because otherwise it becomes late. Finish the topic, okay? So, last time we discussed about the instruments, and I told you about how instruments are important to us and how you should identify the instrument or classify them. Instrument, one question you will definitely get every time in your exams. Okay, so you should be thorough with instruments. In this particular lecture, we'll be talking about different types of instruments. This again will come as a short note, either as a diagnostic instruments, or they might ask you as write about one instrument like a mouth mirror or tweezer or some instrument. So coming to the mouth mirror, it is classified as a diagnostic instrument having a mirror head, a mirror head top, shank, and a detachable handle. If you see the picture, you will see this is the mirror, this is the shank, and this is the detachable handle. Means that when you once buy a mirror and you want to change, if your mirror top gets bad because of scratches or dull and you can't see properly, you can just remove this particular top and change the top. Okay. So it is also the second. What are the different types of mirror? If you see a mirror and the same mirror which we have at home, we have two qualities of mirror. You have a front surface mirror, that is when you see the glass, the front surface is coated with the mirror like paint which gives you the image. So the problem with this is with every time you touch the mirror surface with a sharp instrument or it falls down, this is the coating is going to become dull or it is going to become scratch, and so it is more prone to degradation. Okay. Then you have a back surface mirror, that the mirror image you saw, the front part will be glass and behind it, inside the glass, you will have the mirror like coating. So what happens is if you scratch the surface, you will scratch the glass and not the painted mirror finish which is given onto your mirror. So that way it is more beneficial for us, and that is one which is most commonly used in dentistry. Okay, then you have a plain mirror. This is more commonly used mirror because it provides distortion free image. If you go back to your 12th standard, you had convex surface, concave lens, convex lens. So every lens, if you remember that diagram, was giving you an inverted image or a magnified image. When it is a plain mirror, the image is of same size and it will be clearer. Okay, it will be a distortion free. When you are using a concave surface mirror, which we do use in dentistry, it will give you a magnified image. So advantage of that is that if caries is very small or if the pulp horn is exposed, you will get a magnified image and your vision improves. So at times, especially in endodontics, we do use concave mirrors, concave surface mirrors. Then you have a one-sided mirror, that is mirror is on one side and the back side is of metal. This is the one you are using in your pre-clinics also. So this mirror is called as a one-sided mirror. Then you have a twin-sided mirror, that is the mirror will be towards the surface where you are visualizing, and the back side where you generally have the metal part, that side will also have a mirror finish. So advantage of that is when you're using it in the patient's mouth, if you have to visualize the surrounding soft tissue also, you will be able to see it clearly. Okay. So this was about the mirrors. The uses of mirrors are that they are used at an angle. If the light has to go onto the tooth surface where you have to work, if you have started working on mannequin, you will realize that you will have to, yeah, someone wants to ask a question. Hello. Okay. So mouth mirror could be held at an angle to reflect the light onto the working area. Then when you're working on a patient, you will see that if you want to retract the cheek or the lips, the clinician uses the mirror to move the tongue, cheek or the lip away from the surface where you are interested in seeing, and it protects you from injury. Sometimes in the posterior teeth, when you're working on the lingual side, just imagine your burr, it is moving at a speed, and then you just have to do a cavity preparation on lingual side. The tongue will always be there. You don't cut off the tongue and then do the cavity preparation, isn't it? So there is a way of moving the tongue out of the place. So for holding the tongue back, you are using the mirror. And sometimes for indirect vision also, you require the mirror in your hand. The next instrument which is important is probe. They are sharp pointed hand instruments used to detect caries, overhanging edges and other defects. Every time you go and show your cavity preparation, or you show your restoration, or you show your base, the teacher there is asking you to come with the probe. Why? Because they move the probe along the surface. So when you move the probe along the surface, you will get a sensation called as a tactile sensation. And tactile sensation, if there is an obstruction, you will feel that obstruction on your fingertip, if even if you don't see it. So what is this tactile sensation? If you're sitting in your home, move your hand over your laptop. If you're seeing on a laptop, if you move it on the keyboard, you will think on the trackpad, you will feel the smoothness. Now lift your hand and move it on the keyboard. Don't you feel a difference? Whether you see it or not. Are you doing it? So if that, what is that? That difference is called as the tactile sensation. So every dentist should have very fine sense of tactile sensation, which will tell you between smoothness and roughness whenever an instrument is moved along any surface. Even in endodontic treatment, mostly you cannot see what is inside the canals. But if your tactile sensation is properly developed, you can make out whether you have reached the apex, or there is any obstruction, or there is any ledge formation. So there are different types of probes. You have the straight probes, or you have the curved probes. These curved probes are called as explorers. We don't call them as curved probes. We call them as explorer. Here last time when I told you that when you give an angle to the shank, then you get the working tip nearer to your hand. So the nearer the tip is to your hand, more better is your tactile sensation. Here you see the tip, if your hand is here, the tip is away. If I give a curvature here, the tip will come closer to me. So these curved probes are called as explorers. Then you have your interproximal explorer, and which is used to detect cavity in the proximal area. Here again there is an angulation given so that this tip of the probe comes close, and this tip can enter in between the two teeth. You have different types of probes. You have a Williams probes. This is characterized by a lack of marking on the 4th and the 6th mm. In this picture, you can see the 4th and the 6th mm marking is missing. So whenever, because you have to identify which probe you are using. So that is a Williams probe. The end is flat here. This is used to detect the amount, the depth of a pocket, or sometimes the cavity also. If you have done a cavity preparation, the teacher will put the probe in the cavity and see at what marking is the depth of your cavity. Okay? Then you have CPITN probe. It is an acronym for Community Periodontal Index for Treatment. It has two things. It has a 0.5 mm ball end here, so you can see, and there is color coding between 3.5 mm and 5.5 mm. So all these things have been done so that we can easily detect. Every time you should not take the probe, put a marking there and then measure it on the scale. It is very difficult to do it when you are doing it in the clinics. So here all the markings are present on the probe end. Then you have the UNC 12 probe. It is called as University of North Carolina probe. In all these probes, the main changes are between the position of the markings, difference in diameter, and configuration of the marking, that is whether it is notched or painted. See, here it is a notching, here it is a painting. So there is a difference in that. The CR, please take the screenshot and the attendance also. Huh? Are you listening? If the CR is not joined in, please someone else take the screenshots and you'll have to upload it. Okay?
Yes, ma'am.
Yeah, thank you. So, where are the probes used? They are used to explore the lesion. If you have caries, you want to know whether it is a deep caries, to which surface it is extending, whether it is soft type of caries or hard caries, everything the probe will tell you. Because your fingertips cannot touch that area. There has to be some extension which will reach the area. So the instruments are important for that. It is used for detecting and assessing the carious lesion in the tooth. Detecting if it is present or absent, assessing whether it is soft caries or hard caries, and the depth of the caries. And detecting demineralized dentine. Sometimes there is no caries, but the patient is complaining about sensitivity. So that means that the enamel is lost and the dentine, whichever is there, is not healthy enough. That is why the patient is feeling sensitivity. So if you use a explorer on that surface, the patient will not only feel the pain, but the quality of dentine that you will learn eventually, you will feel it is softer than the adjacent dentine. Releasing of debris from the tooth. This you do so frequently. We keep telling you make sharp line angles, make sharp point angles. And whenever you do a cavity preparation, you find that the tooth debris gets collected into the cavity preparation. Sometimes you just blow it away and it goes off. But from the line angles and the point angles, the debris remains stuck there. So you have to move the probes along those line angles and point angles and clear away the debris. If you fail to do this, then when you do the restoration, there will be debris between the cavity preparation and the restorative material. This micro deficiency will cause recurrent caries because the debris is soft and it is powder. So it will eventually get removed from that area and there will be a defect in your restoration. It is called as a defect between the restoration and the tooth surface. Then identifying hypersensitive areas. Sometimes the patient just complains of pain, and you don't know where is the pain, because it is very easy to say the enamel is lost or the dentine is exposed, but it is not really practical every time to really see those defects. So if you have an instrument and you move along the area the patient is pointing out at, maybe you will be able to identify the area where there is pain, because that tip of the probe will definitely make the area, it will just irritate the area and the patient will feel pain, and you will know that this is the particular area where the patient is having pain. And you have to assess the marginal fit of the restoration. Any restoration which doesn't fit well into the margins is a failed restoration. Remember, the tooth will not get, the tooth is strong, your restorative material is strong. It is the joint between the restorative material and your tooth which is the weakest part of the restoration which you are going to do. And if this opens up, then any good restoration will fail. Okay. So you have seen this, all your teachers do. Whenever you go with the silver amalgam completed cavity, the teacher moves the probe along from the tooth surface to the restoration. What are they trying to see? They are trying to see whether your probe will stop in between. See, if you have a trackpad, you have it, if you're seeing it on the, I think most of you must be on the laptop. So if you move your finger from the surface of the laptop to the trackpad, if you do it, you will find that there is a slight edge there, isn't it? If on a restoration, when you're moving a probe, you feel this edge, that means there is a defect. And that defect is the weakest part on your restoration, and your restoration is going to fail. This is the reason why you don't understand that the teachers are saying that your restoration is not good enough. The teachers become experienced and they think that you understand what they are saying, but you don't understand what tactile sensation is, so you don't grasp what the teacher is saying. So now, henceforth, when you go back to the college and the pre-clinics, you try to develop your tactile sensation. That is the only mantra for being a successful dentist. Whether you are doing aesthetic dentistry, whether you are doing oral surgery, whether you are doing periodontia, any, unless your fingertips know what it is very, very difficult. The next thing is the tweezer or the dressing plier. This you use it so often, but sometimes when it comes as a short note, you don't know what to write in it. So it's very simple. It's a hand instrument which has two arms with two narrow and pointed, sometimes they are pointed, they are straight or curved beaks, used to grasp small objects. What all you grasp sometimes a bird, sometimes a cotton pellet, so many things. You have to have something to pick up the things and take it to the mouth, or pick it up from the mouth and get it outside. So all these things are done by a tweezer or a dressing plier. The uses are, it is used in carrying things in and out of the oral cavity. Second, placing and removing cotton rolls, cotton pledges, sponge pellets for isolation of cavity. Till now, you haven't worked in a patient's mouth. So you don't realize that the patient's mouth is full of saliva. This saliva will keep entering into the area where you are working. So you need to isolate that area and make it saliva free. So there is saliva doesn't come out of a tap so that you can just close the tap and there is no saliva in the mouth. It doesn't happen like this. You have read in anatomy, histology, physiology, there are millions of salivary glands. You cannot close each opening. So you have to suck out the saliva from the area where you work. So the most easiest way is to put cotton rolls. That is, cotton is rolled and placed adjacent to the tooth where you are working, which will absorb the saliva. Third is carrying saliva-soaked cotton rolls from the oral cavity into the disposal unit. You have placed the cotton rolls in the patient's mouth. Then you've finished your work, the cotton gets wet with saliva. You have to move that cotton roll from the patient's mouth and place it back and dispose it off. So for that also you require a tweezer. There is another type of a tweezer which is also called as a locking plier. What happens is, if you've used the tweezer, you know that if you're holding cotton in it, only when you, till the time you're applying pressure, that cotton pellet will be held by the plier. The moment you're talking or chatting with someone or something, if you get distracted, what happens, and your pressure on the plier becomes less, the cotton pellet will fall down. So this, if this keeps occurring into the patient's mouth, it's highly irritating for the patient as well as you. So locking pliers have come in, where there is a lock inside the two, onto the handle where there are the two beaks, and when you press it, it gets locked. So the cotton pellet which you have held into the beak of the plier remains stuck onto the beak, and you can just pick it up and then throw it away. It avoids slipping away of the cotton pellet or anything else into the back into the patient's mouth. Then you have the non-cutting restorative instruments. So in non-cutting restorative instrument, all of you have used this instrument. You have a cement spatula, which is made up of stainless steel. You have a plastic spatula, or you have a agate spatula. So cement spatula, the one we call the cement spatula, is generally made up of stainless steel. Okay. Stainless steel spatulas are more commonly used to mix all type of materials which will not abrade the stainless steel, because if it gets abraded, the stainless steel powder will get mixed with the cement, and that will cause problem in your restoration. So for your simple zinc phosphate and all, you are using stainless steel spatula. But for your earlier, it was materials which are very granular or which contain silica, that like silicate cements and all. You cannot mix with a stainless steel spatula. You have to use a plastic spatula or a agate spatula for that. These are double-ended instrument. The blunt end is used for manipulating the impression material, and the sharp end is used for mixing the cements. Second are the plastic carrying or the filling instruments. These are used for carrying the manipulated cement. You have mixed the cement onto the glass slab. Now you have to carry it into the patient's mouth. So you require an instrument to pick it up and take it to the patient's mouth. So when the material is still in the plastic state, so you have to have an instrument which will hold that material in its tip and then carry it into the patient's mouth. So usually one end is flat and the other end is cylindrical. The flat end is used for carrying the cement. The cylindrical end is used for manipulating and positioning the cement. You have all seen the plastic carrying instrument. Recollect that, and you will remember that there are two ends there. They are generally made up of stainless steel or plastics. The plastic ones are the disposable single-use ones. Then comes the instruments which are used for packing. Here you have the amalgam carrier. Amalgam carrier is a stainless steel instrument. It is used for carrying mixed amalgam to the cavity, and a plunger. See, here is the tip of the instrument and here is the plunger. So when you press this plunger, the amalgam will come out from this end and it will enter into the cavity. They are available in 4 sizes. You have mini, regular, large and jumbo. Mini is used in the cases like endodontic surgery and all, when you are doing and packing silver amalgam at the apex of the tooth when you are into a surgery, that time you require the mini one. Then you have the condensing instruments. These instruments are instruments used to compact the material like amalgam and a direct filling gold material into the prepared cavity. You have placed the amalgam into the cavity. So the amalgam will not just go and settle in all the line angles and will adapt properly to the walls and the floor. You have to press it with something. So those pressing instruments, that is condensing instruments, are very important instruments, and they are to be used to place the instrument material firmly into the cavity area so that it adapts properly. You have two types, the round condensers and the parallelogram condensers. And you have mechanical condensers also, which are not very commonly used and not easily available as well. And most commonly used for direct filling gold in material when you are using. The fifth is the burnishing instruments. Hand instruments with a rounded edge used to polish or burnish the surface of metal to make it shiny, lustrous by rubbing. These instruments are called as burnishers. So you have to burnish, that is, you have to polish the surface. The other thing which burnishing does is that it adapts the material even more better to the uh, sides of the cavity. So generally they are double-ended with angulated shaft. The nibs are spherical and smooth-faced, and they have different shape. I think we all use the egg, a ball shape, but there is a egg shape or a conical shape of burnisher available. Lastly is the carving instrument. So this carving instrument has a blade or a nib which is used to contour the surface of the filling material in their plastic stages. You have different type. You have Hollenbach, you have diamond or the Fram's carver, and you have the Ward's carver. So all these carvers, I think, are covered in your pre-clinic manual also. They come as a short note, so you will have to, because it will be easier for you to read it there. Then coming to the techniques, if you are using the hand instrument, you have to hold it properly, isn't it? Because the manner in which you hold the instrument will also make it more useful. If you have a pen with you right now, so try to hold the pen and I will tell you all the different grasps that are there. So first is the pen grasp. That is the grasp you use to write, isn't it? This is called as a pen grasp. Then you have a modified pen grasp. Here you see that your middle finger is supporting the instrument, the tip of the instrument here. So this modified pen grasp is giving you more support to the instrument tip. So that is why it is important. Then see here. See this is your pen grasp. But here, see the middle finger. The middle finger is holding the tip of the instrument. This becomes the modified pen grasp. Then you have an inverted pen grasp. When you are working on the maxillary teeth, it is not possible to use a pen grasp there. So you turn your hand. So this turning of hand in a pen grasp movement, modified pen grasp movement, becomes your inverted pen grasp. Then you have a palm thumb grasp, where the instrument you are holding in a round fashion inside the handle is covered by your four fingers and the tip is open here, and this thumb is used to rest on the tooth, which you can see in the next picture. See here. This is more for carving and all, for your scaling and all. Generally, in restorative dentistry, we do not require this grasp. So you have pen grasp, you had modified pen grasp, you had inverted pen grasp, palm and thumb grasp, and modified palm and thumb grasp, where you are not tightly holding it like here. It is a loose instrument and you are taking support from the same side. So other than this, if you see here, everywhere, see here, you can see that the a person working is taking support with his fingers to the tooth. So what are they? They are called as rests, and the rests are generally taken to stabilize the hand and the instrument so that it doesn't slip away from the area of interest and hurt. If you're using a cutting instrument and it slips from your hand, then what happens is it will hurt the cheek and the tongue, and the patient will be angry at you. So a good finger rest is important to prevent injury and laceration to the surrounding tissue, and it is always taken only on hard tissue, that is the teeth or the bone. So see all the supports that the person is taking. He is not working without supporting or stabilizing his hand. The last is the guards. Guards are the instruments such as the mirror or a cheek retractor or a lip retractor, which you use to remove the soft tissue from the area of your interest. As I told you earlier also, if you're working on the cavity which is on the lingual side of the molars, the lower molars, then the tongue will keep on interfering. You have to hold the tongue back with a cheek retract, with a mouth mirror, or you have to retract the lips and the cheeks also. Advantages are they avoid accidents, slippage of instruments, and prevent injuries. Lastly, most important is how to sharpen the instrument. If you are seeing Mahabharat, you have seen that Shakuni Mama keeps saying ki apne paason ko sharp rakho. He keeps on polishing them, and that is the mantra for good dentistry. Unless your instruments are sharp, it is not going to help you. So this will prevent pain in patient. If they are not sharp, they will prolong the operative time, they will be less controllable, and reduce quality and precision of tooth preparation. So various methods are there. You have stationary. I don't think so I have enough time, but if I cannot complete this now, I will take it in the next lecture also. So stationary stones or oil stones I use. They are Arkansas, the silicon carbide. This you have seen, if you have a person coming to your place to sharpen the knives, they use all these things with them. They have a wheel on which they have Arkansas stone or a rotating wheel made up of silicon or aluminum oxide, on which they just move the instrument and it becomes sharp. So in short, removal and shaping of tooth structure is an essential part of restorative dentistry. High-speed equipment have eliminated the use of hand instrument till today, but in 2020, with COVID coming in and no aerosol being advocated by the government and all the bodies, we are going back to the hand instruments. So you need to know your hand instruments, and they are a very essential part of the armamentarium. No dentist, just like a physician cannot work without his stethoscope, a dentist cannot work without his hand instruments. So read this. It's an important lecture. I hope you've understood. If you have any questions, you can just put it in the group. I will answer them because I do not have enough time now. And next lecture also is on instruments. All 4 lectures you have short notes. You have full questions coming. One question on instruments is mandatory in your final year. So unless you read about it right now, you will not remember. Okay? All your vivas also, they will ask you questions on instruments. Identification, different types of different types of grasp, rests, Very commonly asked question. I hope I was clear.
Yes, ma'am.
Yes, ma'am.
Please, please do ask in the group, and I think the time is up. So see you in the next week. Okay, take care. Put the questions so I can answer them. Thank you.
Thank you, ma'am.
Thank you, ma'am.
Thank you, ma'am. Thank you, ma'am.
And send the screenshots and the attendance immediately. Yeah?
And meeting here.
काम को लगता है सर्वेंट्स है पर उनको निभाते नहीं रहते।